So there's 12 different types of dementia. The most common is Alzheimer's. I think that, again, to try to get an exact diagnosis is futile because we're just guessing. And what I see is, again, take the 12 different diagnoses of dementia, put them all together, and you probably have a combination of all of them when you're having these issues. So dementia is becoming a major problem. I think the other day I looked it up, 9 million people having this issue. So what are we doing? That's causing neurodegeneration. And as I explained to everyone, whether you're a Parkinson's patient, MS patient, Lou Gehrig's patient, or a dementia Alzheimer's patient, just view your problem as neurodegeneration. Something is breaking your brain down. And then we're back to, what does the brain require to work properly? And the brain requires 3 things. Physical activation. Here we go again. You cannot get optimal without physical care from someone that is very proficient. And I don't mean a manipulator, and I definitely don't mean an osteopathic manipulator, and I don't mean a chiropractor that is using only palpation as their indicator. And anyone that's telling you that the bone is out, go to somebody else. Manipulation can do beneficial things, but that is not a neurological approach, doing palpation and manipulating. But anyway, back to neurodegeneration. So physical care is required. The nervous system develops from the bottom up to the top. So it basically means that the body and the tail of the nervous system, which is the spinal cord, that's housed in the spine, is the beginning of the nervous system. It's not the bottom, it's the beginning of the nervous system. So we must assess this nervous system from a functional point of view, a tonal point of view, and over a time frame, give the brain what it requires: activation, oxygen, proper nutrients. By the way, did I say anything about medications? Activation, oxygen, nutrients. They don't fit into what the brain requires. So every drug that someone may take is adding more stress into an already stressed out system. The other thing I would tell you too is the medications that I see for dementia, Alzheimer's, I don't see them work at all clinically in any of the patients that come into me. I just don't see them getting a change. So if it's not helping your symptom, you're definitely just adding more chemical stress in, and you need to evaluate that to see if it's really beneficial or not. If you want to get a new approach to neurodegeneration, contact Neuro-biomedicine health systems.com.